find more and more people coming in with dryness of their eyes, grittiness. Computer professional or a person who is on the system for many hours a day, more than. And as soon as the eyes get tired out, the brain also feels a sensation of being tired out. Hello, I'm Dr. Susan Varghese, Medical Director of Smart Vision Hospital. So a lot of patients come nowadays who are having more and more screen time, a lot of computer personnel, software professionals, and most people have gadgets, and especially post-COVID, the number of hours that people are spending on gadgets has increased exponentially. We find more and more people coming in with dryness of their eyes, grittiness, and foreign body sensation, and they're having difficulty in focusing and concentrating, and they come in with that, and then come in with these complaints mainly. And then when we examine them, we are able to see that the anterior segment of the eye is absolutely fine, but their tear film breakup time is severely decreased. We do a test called Schirmer's test, whereby we are able to assess that the tear film is very low. That indicates that the patient has dry eye. And a patient who is consistently having dry eye for a prolonged period of time, and if they are a computer professional or a person who is on the system for many hours a day, more than 12 to 16 hours a day, then we call that as a computer vision syndrome. Now, this condition is seen in a lot of the young age group, that is between 20 to 40 age group, where many of them are spending continuous hours in front of the system. So let me just tell you a bit about how the eye functions. The eye is, our eyes are made to be hunter's eyes. In the Stone Age, we had a far-off object where we had to look at, and we had to focus on an animal which was far away, run after it, not a sedentary life like what is being led now, and chase after that, or climb trees to forage for fruits and get our vegetables and daily meat and food. But now everything has changed, and we put a system in front of our face, in front of our eyes, which is continuously there at an abnormally close distance. And then that causes the difficulty where the eyes cannot focus for long hours. So that causes a difficulty in accommodation and a continuous strain on the eyes. So what we advocate for this sort of people, so continuously they are doing this, and also there are people who are not blinking adequately enough. Those who are in front of the system, we are sitting in front of the system in an air-conditioned environment. So the air conditioning, also the blow is right onto the face, and that dries out the eyes, and that causes evaporation of the tears. So blinking should be at least 15 to 20 times in a minute. But when we are concentrating on the monitor and we are doing the work, the blink rate comes down, and that comes to 5 to 8 times. So because we are not blinking, the tears which are being formed by the lacrimal gland is not able to lubricate the eyes. And so the next time when you are blinking, it is causing a scratch on the cornea, which causes the grittiness and the dryness of the eyes. So what do we advise for this? First thing is, we tell the patient or the person who has come in to have a lifestyle change. That alone is not possible because most people have gadgets continuously throughout the day. So what we tell them is to follow the 20-20-20 rule. Now this 20-20-20 rule is very important to follow because it tells the patient, we tell the patient, take a break every 20 minutes while you're working on the system and look at something 20 feet away for 20 seconds. So when you do that, it gives the eyes ability to refocus on something at infinity and focus at a distance and then look back, so that relaxes the eye muscles also. The ciliary muscles will relax. So that also helps because the eye and the brain are connected by neural links, and as soon as the eyes get tired out, the brain also feels a sensation of being tired out. So when this 20-20-20 is followed, the person is also relaxed. And we tell the patient to follow palming, just to do rubbing both the hands together and putting that on the eye. So that also causes a relaxation of the eye. The other thing is to blink frequently. Blinking frequently, of course, will solve the problem of the lubrication of the eye. But in most conditions, because the diet is not adequate, there's more of eating junk food, the lifestyles have changed, so people are eating erratically. So less of omega-3 is coming into the body. So those sort of tablets, multivitamins, which are important for the body, are not reaching, and those are the ones which help for the tear production also. So we advocate that the patient should have multivitamins and also omega-3 supplements, which usually are gotten through, if the person is non-vegetarian, they will get it through sardine and mackerel, or through the small fish that they eat, or in vegetarian sources are flaxseed, chia seeds, walnuts. So the patient will get an adequate supply of these nutrients through these supplements. And also we give tear substitutes. So these tear substitutes are similar to the tears, and the patient will have good relief when we give them. So different tear substitutes are available, and nowadays most computer users are on many of these tear substitutes. But if it is a condition of severe dry eye, then we have further medication that we give the patients so that their tear film will not break up so early, and they will have a comfortable time in front of the system.